Good afternoon, everyone. My name is Chrissy Hudgens, and I work in ASPE's Office of Science and Data Policy within the Division of Evidence Evaluation and Data Policy, and I am pleased to welcome you to the third HHS Capacity Training of 2023. The session is designed to help you understand the range of evaluation types, and during this session, we will provide information on formative and summative evaluation types, as well as provide some illustrative examples of evaluation types in action. And of course, we will highlight important considerations for designing evaluations that meet Evidence Act evaluation standards for rigor, relevance, objectivity, transparency, and ethics. Before I introduce today's presenter, I would like to cover a couple of housekeeping topics. Today's webinar is being recorded. The link to the recording will be made available after the session. Please submit your questions for the speaker using the Q&A tool throughout the presentation. So we'll be answering the questions during the last 10 minutes of the presentation or during the session. And please, I will say this again at the end, but we will have a session evaluation, and we do look at those and use those to continue to improve our presentations for your best use. So without further ado, I would like to introduce Karen Swietek. Karen Swietek is a senior health economist for NORC at the University of Chicago with over 10 years of experience in secondary data analysis, complex observational study, and evaluation of Medicaid programs. Her research focuses on integration of primary care and behavioral health services, alternative payment and delivery models, and racial disparities in quality of care. Dr. Swietek earned her doctorate in health policy and management from the University of North Carolina at Chapel Hill and a Master of Public Health in Health Services Management and Policy from Tufts University. Welcome, Dr. Swietek. We're happy to have you here with us today.
Thank you so much, Chrissy, for the introduction, and thanks for having me. So I will just dive right in. This is a brief overview of the session. We'll plan to spend a few minutes discussing evaluation in general and also in the context of HHS. Then we'll take the bulk of the hour to walk through different types of program evaluation and when to use them. And finally, I'll close with a short discussion of some common challenges people face in selecting and implementing evaluation types. As Chrissy just mentioned, there will be an opportunity for questions and discussion at the end of the session. Please feel free to submit questions in the Q&A. And I also just want to note before I get into it that there's a lot of material to cover on this topic. And so the slides may be a little bit text heavy, but I'll really be focusing on main takeaways as I go through them. And the slides will be available for download, and they include links for further resources. So an introduction to evaluation overall. The Foundations for Evidence-Based Policymaking Act of 2018, or Evidence Act for short, is legislation that was intended to advance evidence-building functions in the federal government. So per the legislation, the definition of an evaluation is an assessment using systematic data collection and analysis of one or more programs, policies, and organizations intended to assess their effectiveness and efficiency. Program evaluation uses the methods and strategies of traditional research, but while research is designed to develop general knowledge, an evaluation is more program or population specific. And it's ideally designed to provide actionable information for program administrators or participants or even funders. A common phrase you'll hear sometimes is that research is meant to prove, while evaluation is meant to improve, which is not to say that methodological rigor and objectivity are not important for program evaluations. Any well-designed evaluation is rigorous and thorough. But while research often aims to control settings or conditions as much as possible, the primary purpose of an evaluation is first and foremost to provide useful information about a program in the real world. So program evaluations can be really big undertakings, but they're really critical to determine what is working and why or why not. An evaluation can help program planners understand the results and outcomes that they're seeing. And some programs may be required to produce evidence from an evaluation to continue being funded. But even if it's not a requirement for funding, evaluations provide important data to inform decision-making about whether to continue a program, change it midstream, or cease altogether. So I just want to pause here and take a quick poll to help gauge where folks are in terms of experience with evaluations and maybe tailor the presentation as best we can to the group. So on a scale, a very simple scale from none at all to a whole lot, how much experience do you have with evaluation? Just give folks a minute to answer here. Okay, I cannot see the results for the poll popping up. I see the question. Ah, there we go. Okay. Thanks for responding to that. It looks like we have sort of a mix of familiarity. Oh, where'd it go? There it is. But it looks like most people on the call have at least a little bit of experience with evaluating. So throughout the session, I'm going to use some illustrative examples from an evaluation that we conducted here with our team at NORC. Before I move on to the evaluation types themselves, I'm just going to take a minute to give a brief orientation to that project. Several years ago, NORC at the University of Chicago was tasked with an evaluation of 23 first-round Healthcare Innovation Award, or HCIA projects, which was through a contract with the Center for Medicare and Medicaid Innovation. Our evaluation was focused on awardees in the complex high-risk patient targeting portfolio, and that was one of 7 total evaluations that assessed 107 first-round funding recipients. The 23 awardees in this cohort that we looked at shared a focus on patients with medically complex conditions, and the projects in this evaluation portfolio took multiple and varied approaches to healthcare reform. So that looked like things like care coordination, redesign of clinical workflow, patient education, different financial incentives, and also workforce development initiatives. So it was really a broad group of heterogeneous awardees and interventions, and accordingly, our team undertook a broad range of evaluation activities. And then in addition to the usual comprehensive annual summative evaluation reports, we also produced rapid cycle quarterly reports with the goal of providing more timely evidence that would allow for mid-course corrections if they were warranted. This graphic gives an overview of the overall evaluation design. We took a mixed methods approach. We used a multiple phase case study design where each of the 23 awardees was a case. And then the phases of the evaluation included an initial determination of awardee evaluability for each awardee. For example, we looked at things like sample sizes, comparators, selection of sites for qualitative observations. And we followed that with concurrent collection and analyses of quantitative data like claims and EHR data, and qualitative data that we collected through interviews, site visits, and surveys. And our findings centered on a few broad domains, which were the implementation and program effectiveness, health impacts, the importance of contextual factors on outcomes, and program scalability and sustainability. Okay, so now that we're ready to walk through the different evaluation types, I'll just pause briefly again, take a short poll. If you do have evaluation experience, select the evaluation types that you do have some familiarity with. Danny, whenever it looks like folks are done answering, you can pull up the results. Okay, so this looks pretty evenly spread. It does seem like outcome evaluations are the most common evaluation that folks on the call have had experience with, but it seems like at some point, most folks have touched on all of these. That is great. Okay, so without further ado, let's jump in to types of evaluations. So I know this is a busy slide and it's really intended to give more of a high-level overview of the evaluation types that we're going to discuss today. It's meant for more of a quick reference later. Don't feel like you need to take it all in right now. The rest of the presentation will touch on each of these evaluation types in more detail, but this slide and the accompanying handout can serve as sort of a quick reference. I do want to note that there is some overlap between the terms that we'll be using today. And this table is meant as a quick reference, but it's not a prescriptive checklist by any means. Many of these terms stem from different disciplines rather than a foundationally discrete approach. And across disciplines, definitions for the terms sometimes change. For example, in some social science disciplines, you'll see more of a focus on formative versus summative evaluation, while in others, you'll hear that discussed more as process versus outcome evaluation. So that's why you might see some overlap and crossover of these terms in the evaluation literature. And in this list, I have highlighted formative and summative evaluations as distinct from the others because these two evaluation types are sometimes employed more as an overarching evaluation philosophy or framework, and they often will encompass the other types that are listed here. So for example, a formative evaluation might evaluate the progress of a program implementation, and it might also assess program outcomes. So these are not mutually exclusive categories necessarily. And then finally, I will add that this is not an exhaustive list. There are other specific evaluation types that I've not included here, but these are some of the most common that you will see. So when you're ready to select an evaluation type, these questions can help guide your decision. First and foremost, what are the questions that you are trying to answer? Are you more interested in barriers and facilitators to implementation, or is the program's effect on its target population a high priority? Sometimes the answer is both, and that might mean that you need to do two types of evaluation. Next, at what stage of the implementation is the program? In an ideal world, evaluation planning would begin in the early stages or even before a program is implemented, but sometimes there are practical reasons that that's not the case. And then it's also important to consider what data are available to conduct the evaluation and who is the intended audience and how they will use those results. So for example, when designing the HCIA evaluation, that was such a broad program that we were interested in a long list of questions, but they ranged from things like what activities were the awardees undertaking? What challenges were they facing when they were implementing it and how did they overcome those? How did the program affect outcomes in the key target populations? And then we'll discuss the answers that we found to those questions a little bit later on. So the first type of evaluation on the list is a formative evaluation. This type of evaluation ensures that a program is feasible and appropriate and acceptable before it has been fully implemented. A formative evaluation specifically seeks to identify if the program design is suited to the identified need of the recipients, and also if the program is mature enough to support a summative evaluation. It can also assess whether stakeholders are supportive of an evaluation and what challenges you might face later on down the road in your evaluation process. Often there's this perception that evaluation is something that only happens at the end of a project, but in reality, it works best when it's a key consideration from the beginning. So in addition to answering questions like, can it work? Formative evaluations can also tell us, how does it work, by giving us more insight into program inputs, activities, and outputs. This type of evaluation is useful because it lets you evaluate progress in trends and results midstream, and it enables program improvement and mid-course corrections, and it really lets you maximize the likelihood that a program will succeed. So on the other hand, summative evaluations are typically conducted when the program is in its final form, although they will often rely on data that's collected during earlier stages. A summative evaluation might include process or outcome measures and will likely focus on changes over time or in relation to a comparison group or both. And this can be useful when your program has been fully implemented and your primary evaluation goal is now to see whether a program is meeting its stated objectives. And choosing between a formative and summative evaluation is not necessarily an either-or decision. As with the HCIA evaluation that NORC conducted, it's often a good practice to plan to conduct both a formative and a summative evaluation because they serve different purposes at different points during the implementation and evaluation process. There we go. So this is an example of a basic component of the process evaluation that we conducted for HCIA. We looked at data on who the awardee programs were directed to, what activities the awardees undertook, which is what you're seeing here on this slide, and then when and where those activities took place. And this allowed us and the client to understand program activities as they unfolded and to monitor trends across groups of awardees as the program was being implemented. So for example, you can see here, care coordination was a common intervention across almost all of the awardees in this cohort, while workforce training was only happening in a few of the locations. So moving on to the next type of evaluation, an implementation evaluation is related to process evaluation, but is often more focused on evaluating both the program implementation and the strategies that are being used for program deployment. So this might include things like looking at barriers and facilitators to implementing the program, also the effect of contextual factors, and this can tell you whether and how implementation strategies varied across participants. This tends to be most useful to understand if and why program plans and activities are or are not working, and it can also help you understand why a program may seem to be working in one context or for one participant, but not in another context or for other participants. So for our HCIA work, a lot of our qualitative data gathering focused on the process of implementation, including barriers and facilitators. For example, we identified contextual factors that affected the ease and the pace of the implementation, which is what you see in the top image here. These included things like regulatory considerations, the local healthcare market that each of the participants was operating in, and also their internal capacity and resources. And then we also looked at implementation experience, which is what you see in the bottom image here. And we found that a lot of the awardees were facing challenges around recruiting patients with complex healthcare needs for their target demographic. And this also resulted in challenges in fostering patient engagement. So through our qualitative data collection, we found that in some cases, this reflected a lack of access to primary care, and then in others, it was more a lack of continuity of care. Outcome evaluations measure the effects of a program specifically in the target population that the program is designed for. This type of evaluation assesses progress in outcomes or objectives, usually in the short or the medium term. So this kind of evaluation can answer questions like whether service goals were met and whether or not there were unintended or maybe unanticipated results of the program. And the context in which this evaluation is most useful is when your primary evaluation goal is to determine whether the program is meeting its objectives in the population of interest. For example, among program participants, did you see any changes in knowledge or attitudes or maybe health outcomes? And then an impact evaluation assesses a program's effectiveness including the overall impact of the program on the larger community. So impact expands beyond the particular target population to assess the overall effect of the program. And this might include local, state, national, or even global effects, depending on the scope and the scale of the program in question. Impact evaluations are frequently conducted at the end of a program, but they can also be conducted at appropriate intervals during implementation or operation. And appropriate intervals in this case really means just after you can reasonably expect to see the program move the needle in terms of impacts. Generally, very early on in the program, it's difficult to expect to see results in terms of program impacts. Similar to outcome evaluation, the impact evaluation is also useful to see whether a program is meeting its overall objectives. And it's also often used to provide evidence for funding or policy decisions. Oops, sorry, my slides are going crazy. Okay. So here we just zoom in for a second on outcome and impact evaluation results for one single participant in the HCIA program. We looked at outcome evaluation questions like, to what extent did the intervention have an effect on staff knowledge and skills? And in this case, for the California Long-Term Care Education Center, we found that participants acquired knowledge and skills that were related to their in-home caregiving profession. They also reported feeling satisfied with the training and better prepared to perform their job. So really positive results in terms of direct outcomes from the provider training that this awardee undertook. And then in terms of impact, we looked at effects of this awardee's intervention on health outcomes in the overall patient population that was being served by this grantee. And we did find a decrease in emergency department visits and an increase in consumers self-reporting good health. And the final type of evaluation that we'll cover today is an economic evaluation, which is actually a really broad category. And it refers to any evaluation that is used to assess the costs and the outcomes of programs or policies. And this might include a variety of different methodological approaches. For example, you might see a cost assessment, which just looks at the monetary value of all resources that are used for a program or intervention. So stuff like staff, materials, facility costs. Another method might be a cost effectiveness analysis, which provides information on health and cost impacts compared to an alternative, and that alternative could also be the status quo. Or a cost benefit analysis, which provides the net benefits, or put another way, the benefits of the program minus the costs in dollar terms. Economic evaluations are useful when you want to assess costs, and that's your primary goal. And they're often evidence that is important to make decisions about sustaining a program in whole or in part in light of limited resources. So we also did an economic evaluation for the HCIA work. We conducted cost assessments for the awardees. These are based on Medicare and Medicaid claims. Our evaluation questions for the economic portion were things like, what were the fixed and variable costs that were associated with the program? What were the effects of the program on healthcare spending? And that is just both in absolute terms and also relative to comparison groups. So one of the core outcomes that we looked at was total cost of care, which is what's depicted on this slide. Among the 20 awardees where we had data available for this question, we found that 10 demonstrated statistically significant cost savings relative to a comparison group. 10 did not. So that wraps up the brief high-level overview of the evaluation types. So I'll just spend a few minutes discussing common challenges in choosing those types. This slide is showing some, but definitely not all of the common challenges you might face when you're trying to select an evaluation type. The first hurdle is often identifying and defining appropriate and relevant evaluation questions, and clarifying this step can go a really long way towards selecting the type of evaluation that is appropriate. Once the evaluation questions are clear, it then becomes necessary to identify what data sources are available for use and which outcomes are actually measurable. And from a more practical perspective, balancing timeline and resource constraints is often also an important consideration. And I'll also add that once the results of an evaluation are in, things like the perception of rigor, for example, for a formative versus a summative evaluation can also be a challenge. Sometimes there is this perception that formative evaluations provide less robust evidence than a summative evaluation. And in this case, it's really important to note and make the case that formative evaluations serve a very specific purpose, which is to provide timely and actionable information about trends, particularly while implementation is still underway. Okay, so I have talked quite a bit. I will pause and open up some time for discussion now, just to run through what are some of the biggest challenges this group has faced. I think we'll put those in the chat. Is that right? Yes, okay. So in the chat, please let us know what sorts of challenges you faced in designing and choosing evaluation types. Yep, so I see limited data availability. That is a very common one. And it generally, in an ideal case, it's best to plan ahead for data availability, think through the evaluation while the implementation planning is underway. That way you can align your data collection with your evaluation plan. Oh, it looks like the chat function may not be enabled.
That's what I was going to say.
That
I
is
don't
why we're
think
here. Okay, my apologies for that. So in that case, we can open it up in the Q&A. We'll pin this for the Q&A session as well. I have one more slide. So just before we wrap up, I just want to make note again of the HHS evaluation policy standards. I won't read them word for word. I'm sure many of you are very familiar with these already, but these are really important considerations for any evaluation, and that's regardless of design or methodology. As I said, these slides will be made available, and we've linked the full policy standards document here. Okay, so that concludes my portion of the slides, and I would just like to open the floor for questions, clarifications, any discussions.
it looks like you have some questions and or comments in the Q&A related to your related to the question or the discussion portion that you opened up about issues with choosing evaluation types.
Timing after the fact and limited resources. Yes, I am very familiar with those evaluation challenges. The timing one in particular is a general challenge. Sometimes people don't start thinking about the evaluation until the program is drawing to its close, and then you realize that it would have been good to be collecting data right along. And there's not much you can do to go back and resolve that issue. I think that one way to mitigate that, aside from planning ahead for evaluations as the program is being implemented, is in general, just to consider what data sources you do have available and what data, what your most important evaluation questions are and how you can repurpose the data that you have available to address those. I will say I personally am not familiar with human capital or organizational maturity models. I don't know if any of our colleagues at ASPE have any experience with those, but I don't think that that is a question that I can speak to with any detail.
It's not, I know it's something that we have discussed in ASPE. I believe it's, where I have seen it is like the Department of Defense uses a lot of organizational maturity stuff. And so I've looked into that. I know that Susan Jenkins has some interest in those models. And so I've looked into those at her behest. In terms of what some of those look like, but that's not something that I'm super familiar with. So I'd really be making a lot of stuff up if I started talking about it more. So that's the most I can say. I wanted to ask, I guess, a little bit more, or one of the things that I find most interesting in most things is how messy, I guess, things can get in terms of when you're choosing your evaluation type, or really in anything. And I know I was part of an evaluation where we were trying to choose our evaluation type, and we kept sort of getting stuck where it came to, what data we had available. And part of that kept running into what data we could get from sites, the PRA piece, and everything else. And so we were very much stuck in, and it was just starting, but we had just come in as the evaluation team, but the project was already moving, and so we had to sort of jam ourselves in there, and the project wasn't built with evaluation in mind, and just how very, very messy it is and how difficult it can be, really, to gain access. I think also in terms of, I don't know, I guess just sort of thinking about all of the different ways that evaluation can be so difficult, I think, in terms of choosing your type and wanting to be really rigorous, but also that it has to do with people, and people in general are not known to be, rigorous as a group. And wondering if you could speak a little bit to, how do you weigh those things? How do you bring all of that, to bear?
Yeah, there is always this aspect, especially on the data side, of just sort of challenge mitigation. I'm going to sound like a broken record, but I do think the best way to avoid that is to plan for your evaluation while you're planning for your program implementation. And you could tell that I'm an evaluator, just begging program implementers to think about the evaluation before they get started. But I do understand that is very rarely the case. I will say the way that we have presented these evaluation types here as discrete categories, I would hope would not be a prescriptive or limiting framework for thinking about this. If you don't tick all of the boxes for doing, say, an outcome evaluation, that doesn't mean you can't still answer some of your evaluation questions. And so I think doing something like a program logic model and then connecting that to your overall evaluation goals, like what questions do you really need to have answered, and just connecting those two things will sort of lend some clarity to which evaluation type is going to get you closest to those goals, if not, 100% of the way sometimes.
That's really helpful. Thank you. We have a couple of questions both in the Q&A and in the chat. Are there times one might choose not to evaluate?
Oh, that is a great question. I'm hard pressed to think of a situation in which not evaluating feels like the best decision, unless it is just an extreme administrative burden on program participants. Resource constraints are always an issue, and so maybe you wouldn't decide not to do an evaluation entirely, but I do know that we at NORC have a lot of conversations about surveys and interviews and just the participant burden of participating in qualitative data collection. So you may choose to try to minimize that as much as possible by leveraging maybe existing documents, program documents that you can get the answers to your questions through doing document review rather than bothering a busy provider who's participating in probably several programs and gets, multiple requests to participate in data collection. So I guess I wouldn't, as an evaluator, advocate for skipping the evaluation entirely, but there are circumstances where either paring back or pivoting or changing your evaluation approach may make the most sense.
We have another question here about what advice do you have for researchers who may have to start evaluation later than planned and are therefore limited on time for formative evaluation?
So I guess if the question is how to do a quick and dirty formative evaluation, in some cases, if it's way later than planned and the program is just already, kind of in its final stages, the answer is it may just be too late to engage in formative evaluation. If your evaluation is going to take so long that the answers to your questions will not be relevant to program implementation, then you may want to consider your evaluation summative rather than formative. But if you're, right in that gray area and you just really need to produce some quick results, I think that considering, this is the answer to a lot of these questions, apparently, considering your available data sources and kind of triaging what is going to be the most labor intensive and the most burdensome and just working your way down from there. Things like a program qualitative document review are usually fast ways to get answers about what a program is doing. So if you're doing a process evaluation and you need quick answers, document review, maybe a couple of targeted key informant interviews will get you answers much quicker than a full-scale participant survey or trying to speak to focus groups of patients. So I think that we're getting more into methods than we are evaluation types, but there are definitely, higher effort and lower effort methods that can be considered when you're short on time and or resources.
Thank you. We have another question. As a science generating agency, it is hard to land on approaches that really get at outcomes, given most frequently it is other agencies implementing the intervention/prevention strategy based on the science generated. In general, these data are siloed and not linked in any meaningful way. So even though I think there is some general consensus that generating new science/validating scientific findings ultimately helps further patient outcomes, it is very difficult to describe that relationship. Are there newer evaluation approaches/models that can help account for delinked data or that account for large degrees of variability?
There are a lot of portions to that, so I'm just thinking through.
It's a big question.
Yeah,
It's a good one.
it's a great question, and it's a very common challenge in evaluation. Large degrees of variability in data, is that how we're interpreting?
I think there are a couple of things here for me about siloed data not linked is one of the things that I pick up on because I know that's something that keeps coming up. So better ways for maybe linking data that have a lot of variability. And then looking at, and please, whoever put in the question, feel free to clarify or to, I don't know if you can unmute yourself and clarify that way. Come be part of the conversation. Or also about if it's looking at, if you're an agency getting some of the data from other agencies that are producing the data. And so maybe there's like a gap there as well. that's part of what I'm
I
also
do know
getting.
this is a very big focus, just in general right now, is data interoperability and how to make it easier to link those sorts of things. I am not a back-end data person, so I don't think that I will have any lightning bolts of inspiration for this. But I will say, if the issue is in collecting the data and then linking it, there are methodological approaches to linking the data. Sometimes the silo actually means that you just actually cannot get at the data. And so that goes back to kind of stakeholder engagement for the evaluation, starting early, thinking about during the formative evaluation, who are the key players and stakeholders that are interested in these evaluation results, and how can you get them all to the table and on the same page about getting that data together. And that's again sort of an earlier in the process thing, because it can be hard to do at the end stages of a program.
Making sure that everyone's asking the same questions in the same way. Ooh, we do have, I scrolled down further. Some data is connected from grant to, say, a publication, but less so a clinical guideline, as an example. Okay. We have about 15 minutes left, 16 minutes left. I wanted to ask, I know that, we had spoken about this a little bit before, as we were putting the presentation together. So I apologize for putting you on the spot a little bit. But in terms of, how some of these evaluation types sort of crosswalk with some evaluation approaches, since this came up in this question here. And how, like, if you could sort of help talk through a little bit how they are similar and different, since we've talked about evaluation types, evaluation methods, and now evaluation approaches, and how they are all obviously linked, but different in their ways.
Yeah, I mean, there are a lot of connections there, and I'm a huge advocate for mixed methods evaluations when possible. A lot of times you'll see things like outcome and impact evaluations tend to be more quantitative in nature, and the formative process evaluations tend to skew more qualitative. And some of that is due to some of the data constraints that we've been discussing, or things like timeline and resource constraints. But I am a huge advocate for trying to make things mixed methods pretty much across the board throughout the evaluation life cycle. Just because, looking at moving the needle on an outcome metric doesn't tell you the whole story. It's really important to get that qualitative context in there as well. And I do think that almost all evaluation methods and approaches can be applied across these evaluation types.
That's really helpful. Thank you. I feel the same way. We have near and dear to my heart. Can you tell us a little bit about participatory based evaluation methods?
Sure, yeah. So participatory evaluation is it's an approach that involves the stakeholders of a program or a policy in the evaluation process itself. And so that can occur at any stage, but I think that, and this is not my area of expertise, but I do think that best practice is sort of to try and involve as many people at as many stages as possible. From the evaluation design, also to data collection or analysis, or contextualizing findings, reporting how dissemination is carried out, who the target audience should be. And you can take a participatory approach with any of the evaluation designs that we've discussed today. Some examples would be, involving patient stakeholders in naming or framing the problem that you're trying to address, and helping them, or having their help in defining your outcome goals. It doesn't necessarily mean that your patient stakeholders will be involved in the literal analysis of the data, but they will be advisors to the process along the way.
when I was at ACL, we had a 5-year-long participatory evaluation of our Title VI program, which is the nutrition and supportive service and caregiver program for American Indian, Alaska Native, and Native Hawaiian communities. And so we used a participatory approach because it's more in keeping with, Indigenous methods, participatory Indigenous methods. And so we had an advisory committee, but we also worked with our grantees who were part of the evaluation. And so we had a constant conversation with them about, how we were going to design our evaluation. And when we finally had all of our findings, we actually sat down and used like a mural board because at that point we were in COVID. But prior to that, we would meet once a year and we would all come together, and went through the findings and made sure that, it was that how we interpreted it was the same way that they interpreted the findings, so that we could also have clarification. But they were very much our research partners. I remember our very first, sort of meeting all together, the way that we wanted to collect some of the data. We called them our evaluation working group, and they were like, no, you can't do that. You can't come here and you can't do it that way. You're going to have to do it this way. We had to change a lot, but it definitely is found it to be a much richer form of evaluation and took a little bit longer. But I think that the project was better for it and definitely much more appropriate for the communities with whom we were working. Thus near and dear to my heart.
Do you feel like that process made the results feel more relevant or impactful?
Yes, I also feel like we learned a lot more about the programs that we were working with, just given historically what the relationship with American Indian, Alaska Native, communities is like. And I think that it really helped us better engage with those programs and better learn how the programs were working and what we as the federal government needed to do to improve our processes to better support those programs in the long run. But yeah, one of my better evaluation experiences overall, I would say, a lot better give and take, to the point where I have actually tried to make all of my evaluations, as participatory as possible, even if they aren't a fully participatory approach, in that sense, just because it's so much better. I think when people feel like they have I don't want to say a stake, but when they feel like they have a say, and an opportunity to participate more fully in the evaluation and what is happening with the evaluation in that sense. Do we have any other questions for Dr. Swietek? Well, while people are thinking, I absolutely want to say thank you, Karen, for that presentation. It was really wonderful, and we really appreciate you sharing your knowledge, expertise, and insights around this topic.
Thanks for having me.
We want to make sure that everyone knows that we do have a brief feedback survey. We like to evaluate. We want to make sure that you take a couple of minutes before we finish out to give us your feedback so that we can keep improving upon what we are doing here. We do want to thank everyone for attending today's webinar. Our next training will be on May 16th, and we'll cover how data policy decisions affect evidence building. We'll also be posting the recording, slides, and handouts from today's session. And I hope that you all have a fabulous rest of your day. The evaluation survey will pop up when we close the webinar. So thank you all very much for coming. I hope you have a fabulous rest of your day. And thank you all, and see you next month, if not before.